2,000 patients over the age of 65 undergo emergency abdominal surgery every year, and of these, 1 in 10 will die following this operation. This rate is twice that of younger surgical patients, which is especially concerning given our ever-aging population in Aotearoa. I work as a doctor in general surgery. We know that older patients take longer to recover following major surgery and have higher rates of complications. Current risk prediction tools in the setting of emergency surgery are not routinely used because they require a large amount of information and are hard to interpret. I want to find a way that is straightforward to identify which elderly patients are at highest risk of having these adverse outcomes using sarcopenia. Sarcopenia is muscle failure, primarily caused by aging, but also by cancer status, coexisting illness, and other factors. We are measuring sarcopenia in 2 ways that are practical in the emergency setting. First, as reduced muscle mass on the patient's abdominal CT scan, which is routinely captured as part of their diagnostic workup. Our meta-analysis of international studies has shown that reduced muscle mass in this way is correlated with adverse outcomes. The second way is muscle strength, measured by hand grip strength. This is a novel technique which is easy to administer and use by clinicians and easy to interpret. It's also non-invasive and inexpensive. We've recruited 90 participants into this study at 2 hospital sites in New Zealand, and we've measured their muscle mass and strength at the time of their operation. We are following these patients up to 1 year, and I'm using this information in order to create a risk prediction tool that accounts for age, sex, and ethnicity in order to classify these patients as sarcopenic or not. We're planning to use this on a digital app in the clinical setting. This risk prediction tool can identify vulnerable patients so that clinicians can institute bundles of care at the early stage in the recovery process. This will enhance patient-centered recovery and optimize outcomes so that we can, for our elderly surgical patients in Aotearoa, thus breaking this wall. Thank you.